As we all know, building a broad coalition of advocates around social connection is one of the most critical elements in our fight to address social isolation and loneliness on a national level, and as you heard earlier, even on a global level. With that, I'd like to introduce Katie Holcomb, who's the Population Health Strategy Lead in Health Affairs and Advocacy at Humana, and lead of the Far From Alone campaign, and Laura Belazis, Senior Director of Strategy and Impact at Meals on Wheels America, both of whom will share with us efforts underway to raise awareness nationally. Katie and Laura, thank you for being here today. Thank you for your partnership, and I'll turn it over to you.
Thanks, Eddie. Katie, I know we know each other well, but I wanted to give us an opportunity to introduce ourselves to the audience as well. So I'm Laura Belazis. As Eddie mentioned, I'm the Senior Director of Strategy and Impact at Meals on Wheels America. Meals on Wheels America is the national leadership organization serving 5,000 local grassroots senior nutrition programs nationally. Within the organization, I oversee our work around social connection and in-home safety. And Katie, I'd love to give you an opportunity to introduce yourself as well.
Sure, thanks for having me. I'm Katie Holcomb, and I'm a corporate strategy lead in Humana's Office of Population Health. I've been at Humana for over 9 years. In this role in June last year, right in the middle of the pandemic. I actually met a couple of colleagues for the very first time the other day. In my current role, I help lead national partnerships with organizations that address health-related social needs for our members and our communities. And I also support internal and external communications to promote the work and results of our team. And I live in Louisville, Kentucky with my husband and 2 boys, and I really look forward to traveling in the future and meeting the folks from the foundation and the coalition in person, along with the amazing organizations listening in today. So Laura, I'd love to kick off with your perspective, knowing everything that Meals on Wheels has experienced prior to and during the pandemic. What is your organization doing to address social isolation and loneliness and promote social connection?
Thanks, Katie. I'm sure a lot of folks in the audience are familiar with Meals on Wheels America, especially those of you in the US. You know, we've been around since 1940, and Meals on Wheels America is a household name, but I think we're less well known for our work delivering more than a meal. You know, within this, we have 4 core pillars: nutrition, safety, community connections, and socialization. And social connection has been at the heart of our services since the very beginning. You know, every day Meals on Wheels programs are conducting wellness checks when they're delivering meals. And that driver may be the only person that a client sees that day or even that week. You know, many Meals on Wheels programs have enhanced social connection programs that go above and beyond this. Friendly visiting programs that are, you know, in person or over the phone, classes like art classes or group exercise, games and group activities, you know, pet services to support animal companions, you know, and so much more. And we've seen an enormous amount of creativity as local programs have adapted many of these activities over this last year to protect their clients' health during the pandemic. You know, on a national level, Meals on Wheels America conducts research into program effectiveness. We provide learning opportunities and share best practices, and we provide funding to our local programs to help them grow and scale their social connection programs. And externally, we're part of national advocacy efforts and important campaigns like Far From Alone. But that's a little bit about us. What about Humana, Katie? Tell me more about Far From Alone. How did it come to be, and what's its purpose?
Sure. Well, the thing I love the most about my team at Humana is that we're all about helping people address the barriers that are getting in the way of their best health, right? So one of those barriers, obviously being loneliness, it got a much needed spotlight on it during the pandemic, obviously, but to do this work right and help our most vulnerable populations, we can't do this alone, no pun intended. We partner with local and national organizations on solutions to address social health needs. So Humana started a public health awareness campaign called Far From Alone with the coalition last year because we wanted a way to bring together all the great solutions of organizations all over the country to help people feel more socially connected. And we knew that many organizations all have unique and effective things to offer to help address loneliness, learning about lots of those organizations too, more of them in the chat. And we wanted to share it with the world through this campaign. So Far From Alone brings together partners committed to addressing loneliness and social isolation and promotes resources to help people feel more socially connected. And you'll find those resources on our website, farfromalone.com. But it's really more than just a clearinghouse of resources. We also wanted to build a community that normalizes loneliness and drives more conversations about it. So we created Far From Alone social media channels, and you can follow them on Instagram, Twitter, and Facebook at Be Far From Alone. That's BE Far From Alone. And also recruited over 25 organizations to join us in the campaign and spread the word, including Meals on Wheels.
Katie, you were talking about normalizing loneliness, and I think that's a really important goal, and it's one that has come up as a theme that I heard from other panelists today. I know it's something that you and I have talked about, but I'd also really love to hear more from our audience about that. So we have a poll question that we'd love to put out there and to hear from you on, do you feel that loneliness is normalized in your community?
Great. So we'll give everyone just a minute to respond to the poll. And I believe we're going to put some questions in the chat as well, in addition to the poll questions. So when the poll wraps up, we can take a look at those results. All right. So it looks like, do you feel that loneliness is normalized in your community? A pretty good mix. It looks like the majority is more than in the past, which is slightly good news, but then, still quite a bit of people that feel that it's not normalized. So, that really shows that there still is a stigma and a lot of work that we can be doing as organizations involved with this work. So thank you all for responding to that. And like I said, I think there's going to be some questions in the chat that you all can respond to. So we'll look at those comments here in a little bit. So Laura, we're so grateful that Meals on Wheels is one of our valued partners in our Far From Alone campaign. So can you tell me why Meals on Wheels decided to join Far From Alone?
Yeah, absolutely. When the campaign first approached us to serve as a partner to advocate for policies to help combat the negative effects of social isolation and loneliness, it was a natural fit for Meals on Wheels America. Many of the risk factors for social isolation and loneliness, like living alone or having a past experience with falls, are common among individuals receiving Meals on Wheels. We serve seniors who are often isolated and forgotten and left out of a national conversation. Far From Alone is an opportunity to create a national dialogue around social isolation and loneliness. And we're here to also make sure that seniors are an important part of that conversation. With that in mind, we felt that our experience could provide valuable insights and support the campaign's awareness building efforts, specifically around older adults. And it's also a great opportunity for us to learn from others in this space. I think we're at a really important moment in time, and I do think it's a silver lining of the pandemic that we're bringing social isolation and loneliness into the spotlight. We have a really great opportunity right now to amplify our message across all of our channels. This is no longer a silent epidemic, and we have effective strategies to address social isolation and loneliness. Katie, I know we've really loved being partnering with you on Far From Alone this past year, and I'm really excited to see what it's going to bring in the future. So can you give us a little sneak peek of what you have planned for 2022?
Sure. Thanks, Laura. So now that we've achieved awareness of Far From Alone, we're now planning to take more action. How appropriate, right? So we plan to begin targeting more individuals experiencing loneliness, starting with activating Far From Alone in a specific community and potentially creating special events around it. And I know tomorrow's theme of the Action Forum is activating locally, and that's exactly what we're looking to do. So more to come on that. And we're also going to explore having physicians and clinicians share Far From Alone as a resource for their patients and their families. And as always, we encourage everyone to visit farfromalone.com and share this as a resource with your loved ones. So Laura, I want to wrap up with what you've learned in the past 19 months at Meals on Wheels. I know we've all learned a lot during this time. So what is your advice on how people can get involved in addressing a social health issue like loneliness?
Well, I think the most important thing that I would highlight is no matter who you are or what you do, that there are ways that you can make a difference. If you're a policymaker, ensure that social isolation and loneliness is a key consideration. I know when we were advocating for the reauthorization of the Older Americans Act, we were really vocal about ensuring that social isolation and loneliness was included in that. If you're a researcher, continuing to help us to grow our understanding of what the most effective approaches are. But I'd also encourage academics to think about their research and how it can be translated into practice. Often gold standard research practices aren't practical or feasible for community-based organizations on the ground. Or if you're a community practitioner, I think it's really important that we're not reinventing the wheel. I think we heard this as a theme earlier as well. There are phenomenal evidence-based and practice-tested solutions. And there are often, programs that already exist around you in your community that you can tap into and enhance. So thinking about, how can you make sure that asset mapping and tapping into those existing resources is a key part of what you're doing to address this effort. Or if you're a concerned individual who wants to make a difference in your free time, consider volunteering with a local Meals on Wheels or another community-based programs. Those are just a few examples, but there's so many ways to be involved.
Definitely. And those are great recommendations, Laura. And I would add that volunteering or even simply checking on one of your neighbors who lives alone and saying hello is a great thing to do. As you mentioned earlier, regarding some of the older adults who may have Meals on Wheels be the only interaction they have all day. So we can all be part of the solution here. So thank you, Laura. Incredible work you're doing with Meals on Wheels to address loneliness. And I enjoyed this virtual fireside chat. I hope to do this in person next time. So we're going to transition over to the chat to see if we have any responses to our questions. We had 2 chat questions. What are your suggestions for meeting people where they are to address loneliness? And what is one way you can bring awareness to social isolation and loneliness in your community?
I think meeting people where they are is a really important consideration. One thing that we think about is, what are the assessment tools that we're using to really evaluate where someone is on the spectrum of social isolation and loneliness. These are subjective things. Loneliness is a very personal experience, and how we receive interventions is also a really personal experience. And making sure that there are ways to assess, what type of intervention is most appropriate for one individual, because it's probably different from what I might want or what their neighbor might want. And then thinking about what's the range of solutions that we can offer.
Definitely. Yeah, I see some really good comments in the chat. Isolation is objective, loneliness is subjective. Yes, very true. I see a comment about rural communities. That's something that we've been exploring at Humana as well. I think it's an untapped opportunity that we will definitely start thinking about as we look at the next phase of Far From Alone. And I'm sure a lot of other organizations will be looking at that as well.
Yeah, I'm seeing this question about rural communities and how we can bring programs to rural areas. I think that's another really great opportunity right now because of the pandemic and because of the creativity that programs have had to bring to this. And, there's been so much adaptation to a virtual environment. And I know that's been a struggle, and there's a huge digital divide that we all need to be aware of and working on. But it's also made a lot of programs accessible to folks who couldn't get to, a place where an intervention might have been delivered in the past. I think we can tap into a lot of those virtual resources to make programs more accessible in rural areas as well.
Absolutely. I see some other comments about just thinking about meeting people where they are, learning about their interests, and then sharing about fun ways to socialize connected to interests, connecting in intentional online groups. I've seen some other partners talk about, or other organizations talk about peer support groups today. So I think there's an opportunity there. Yeah, lots of good comments, great ideas. Hopefully we'll save all these and work with these. I love these comments and suggestions. Anything
question there? Yeah, I saw one question on there. What's one thing that we feel is missing in terms of programs? And that's one where I wouldn't speak to a specific program, but just I think it's important also to acknowledge that the way that that funding is structured can often be really limiting for programs trying to bring new programs, I think Meals on Wheels programs in particular sometimes see that, and that the way that their funding is structured, it's hard to offer new programs because they have to fall within very specific guidelines. So I would also encourage those in the audience who are thinking about kind of policy making and funding structures to take that into account, and how can we make sure we're giving the flexibility to spur new innovations and interventions.
Definitely. Great ideas, everyone. I really appreciate the time and the responses to the poll and the chat questions, and thanks for spending time with us.